this is a fantastic, this is a Rembrandt of cases. So this is a 2020 screen. This is from a single tomo slice. This is a 2021 screen. You're going fast. It's very easy to say, okay, this looks about the same, a little rotational difference, but the case score is again elevated. And the lesion score was 60 here. So that was the highest lesion. The case score typically maps to the highest lesion score. And so I looked at this, I looked at the old, it's very easy to think this is just superimposing tissue at an angle. That's how I initially proceeded. I convinced myself, okay, this wasn't there the year before. Let me call it back. These are the hard cases when there is just a subtly increased density that can look like glandular tissue. And then on the MLO, on the 2D, there's not much there, but on the 3D, on one single slice, you could start to see something concerning. Going on a Cine clip, going through the tomos in Cine mode where you're just watching the video over, it's very easy to overlook something like this, especially as it's so adjacent to overlapping tissue. This is a hard catch. And so this was the same finding on the MLO. She proceeded to get an ultrasound and proceeded to get biopsy, and again, an invasive lobular cancer. So these are, again, the harder, sneakier cancers that don't spread in the typical fashion. We were able to catch a relatively small, aggressive cancer that could have easily been overlooked in the sea of data, that which is a tomosynthesis exam, and we diagnosed it confidently. And you can see our clip is exactly where the abnormality was on the CC, and also on the MLO. So this is a pretty good catch. And this, again, this patient was called back because the algorithm said, hey, look at this area a little closer. And that forced a little bit more introspection on this case, and an early cancer was caught.